Did you know that if you apply for a Medigap policy during your 6-month open enrollment, that an insurance company cannot turn you down and they cannot hold pre-existing conditions against you? Hi, I'm Larry Goist, owner of LMS Insurance Group, where we teach seniors all the ins and outs about Medicare. So in today's short video, I'm telling you guys all about Medigap Plans, which are also called Medicare Supplements. We're going to go over 4 quick topics today. So number 1, I'm going to tell you about what Medigap Plans are. Number 2, how they work. Thirdly, I'll tell you about your Medigap open enrollment period. And then finally, most importantly, we'll talk about whether you even need one of these Medigap plans. That's all coming up next. So as so many Medicare beneficiaries realize when they turn 65 that Medicare is not free. Even though you have paid in 40 years of taxes to have this, you do not get it for free at 65. So there are deductibles, there are co-insurance, and there are co-pays under Original Medicare. So under Part A, you have a $1,556 hospital deductible. Then if you've been in there for 60 days, on day 61, you start paying a copay per day. So at day 61, you pay $389 per day. Then if you were in the hospital more than 90 days, you start paying $778 per day under Original Medicare. Now with skilled nursing care, after you've hit day 20, you have a copay for that too. You have to pay $194.50 per day, days 21 through 100 on Original Medicare. Under Part B of Medicare, which is your outpatient, your medical coverage, you have a $233 deductible, and then you have to pay 20% of all claims. So Medicare pays 80% and you pay 20%. And there is no cap on that number. So you're paying 20% for things like outpatient surgery, chemotherapy, diagnostic radiology, and you will pay 20% to infinity under Original Medicare. But don't worry. Do not let those numbers, those deductibles scare you. There's something you can do about it. You can purchase a Medigap plan. So what is Medigap coverage? Well, when you have Medigap coverage, your Medicare remains your primary payer. So your A and B pay first. So your physician, your doctor, they still bill Medicare directly. Medicare pays their share of the claim, and then they send it to your insurance company who pays their share. And because of this, you are still under Original Medicare. So you're not restricted to a network, and you don't have to get referrals from a plan. So these Medigap plans are designed to pick up the gaps left behind by Medicare. The gaps, which are the things we just talked about, the deductibles, the co-insurance, and the co-pays. Now, Medigap plans are standardized. And what that means is, if you have a Plan G, it is exactly the same with every insurance company. A Plan G with United Healthcare is the same as a Plan G with Anthem Blue Cross Blue Shield. It has to cover the exact same benefits because it is standardized. So, as you can see from this chart on the screen, there are 10 Medigap plans that are offered. Each one of them, no matter what insurance company you get them from, has to cover these specific benefits. So they name Medigap plans after the alphabet A through N. And as of 2020, you could no longer get the Plan F or the Plan C because of a law called MACRA. So they eliminated any plan that covered the Part B deductible. So if you started Medicare on or after January 1st of 2020, the Plan F and the Plan C are no longer available. So the plans that we see Medicare beneficiaries go with more often than not now are the Plan G and the Plan N. So on a Plan G, the only gap that is not covered by the Plan G is your Part B deductible. So that means every other service is going to be paid in full. So you won't get stuck with the Part A deductible because your Plan G pays that. You won't get stuck with the 20% co-insurance by Part B. Your Plan G pays that. As you can see from the chart, the only thing the Plan G doesn't pay is it doesn't pay your Part B deductible, which is $233. Now, if we pivot over to a Plan N, you could see it's very similar coverage. It pays 100% of your hospital deductible. It pays 100% of your Part B coinsurance. Now, it doesn't cover your Part B deductible, the $233, and it doesn't cover Part B excess charges. Now, on a Plan N, you could also be charged up to $20 to visit a doctor, and you could be charged $50 if you go to the ER and you're not admitted. So the great thing about Medigap plans is that because you have 10 to choose from, which is really 8 now, you could pick whatever level of coverage you're comfortable with. And any plan that offers less coverage is going to have a lower monthly premium. So a Plan G is more than a Plan N because it has more coverage. It covers more of those gaps. So how much do these types of plans cost? Well, that all depends on how old you are and what part of the country you live in, okay? But in general, for somebody that's turning 65, a Plan G is going to be anywhere from $100 to $130 a month, where a Plan N is going to be anywhere from $80 to $100 a month. Now, we live in Ohio, so those are the rates that we see most often in Ohio, and it's pretty consistent across the country for someone turning 65 that you would be somewhere in those ranges. Now, as an independent insurance broker, we quote our clients with over 50 different companies. So, we don't just say, hey, this is the Medigap plan, take it. We're able to quote by your zip code. We could look at rate increases in the past, and we could pick which Medigap plan is going to make the most sense for you and your needs. But the most important thing to remember is these plans are standardized, right? So if you have a Plan G with Aetna, it is exactly the same as a Plan G with Humana. The only difference is what the insurance company is charging you monthly to have that plan. So when should I buy a Medigap policy? Well, the best time to buy a Medigap policy is in your Medigap open enrollment period, okay? And that period starts when you pick up Medicare Part B. So for most people, it starts right at 65, right? You picked up A, you picked up B. You have 6 months to enroll in a Medigap plan without having to go medical underwriting. Now, if you delayed Part B because you had group insurance, then your open enrollment would start 6 months from the day you picked up Part B. Now, if this is a one-time open enrollment, this is not yearly. So don't confuse this open enrollment with the open enrollment that goes every year between October 15th and December 7th. That is not for Medicare supplement plan. So if you miss this 6-month window, your open enrollment window, then you would have to health qualify to get a Medigap plan. So the insurance company is going to ask you a whole slew of health questions. If you can't pass all these health questions, they can charge you a higher rate, or they could just simply turn you down. So if Medigap coverage is something that you value, it definitely makes the most sense to get it during your 6-month open enrollment. And that's a one-time window. If you don't use it, you lose it. So how do you know if you need a Medigap plan? Well, that answer is going to be different for everybody depending on your monthly income and depending on your health. But I will say this. The Kaiser Family Foundation did a study in 2016, found that 81% of people on Medicare have some sort of supplemental coverage, whether it's an Advantage plan or a Medigap plan. And the reason for this is because on original Medicare, you have unlimited risk. You're paying 20% of ambulance rides, of outpatient surgery, of cancer treatments. It's just unlimited risk. So whether Medigap is right for you or not is going to depend on your certain situation, and that's what we are here for at LMS Insurance Group to help. So we are licensed in 20 different states across America. We can give you quotes with over 50 different A-rated insurance companies to find out if this is the type of plan that's right for you. All of our clients receive lifetime claim and billing support services. You'll never have to call an 800 number to fight about a claim. We do all that for you. So guys, I hope this video was helpful. If it was, give it a like or a share. If you need our help, please reach out to us with the contact information listed below, and I'll talk to you guys next time. Thanks for watching.